Welcome. Thank you for joining us for this week's cross-industry session focused on safer at home public health updates, helping you reopen your business, answering your questions, and getting the most up-to-date information we have on our current public health crisis. As we move forward and as things change, as our numbers change, as you read information in the news, as we embark on this new dial that the state released, it's important that you keep coming back to these sessions or listening to the recordings or reading the emails that I send out each week so that you can get the information you need and the resources you need to have the most accurate information. In between these sessions, please ask your questions and get those responses that you need in order to open and have the safe practices we need as a community to stay within the right part of the dial. During the session as normal, if you have any questions, please put them in the chat or the Q&A and I'll ask them on your behalf. But first, I'm going to hand it over to Jesse Rounds of Boulder County Public Health.
Thanks, Corinne, and good afternoon, everybody. I will jump right into the update and get to the Q&A as quickly as we can here. So what we'll go over today is just our case update, some epidemiological details, then we'll get into the dial and our situation with respect to the dial, and then we can just jump straight to Q&A. So, as I'm sure you're well aware, we are in a situation where we're having, over the last 2 weeks, we've had a huge spike in cases. And I think this chart is illustrative of where that spike is coming from and where our policy and our attention is focused right now on trying to address that. We are definitely in a situation where we need to work with CU to try to address the spiking cases within their community. Before this spike, we were in a very good place as a community, and this has changed that, but we are working with CU, we are working with the state to try to address that. To that end, with CU, we have instituted the 14-day quarantine period, as well as you may have seen that now all classes are online. So there is ongoing communication with CU. We are working with them to try to figure out new ways to address this, but right now these are our two methods for really getting at that, and we're hoping that that's going to help us get this under control. And all that is necessary because under the dial, we are subject to this system where all of us started, all the counties, or the majority of counties started at safer at home level 2. And then what the state has said is every 2 weeks, if a county can show numbers that allow them to move up on the dial towards safer level 1 and protect our neighbors, they can do that. However, if they see numbers decreasing, there's a different process, and I'll go into that in a little bit. But the important thing is we're at safer level 2, and as I mentioned before, our case counts over the last couple days have been much higher than the 175 per 100,000 cases, or 100,000 population. So that puts us at risk of going down the dial. And I'll talk about that in a little bit. But right now we are in safer at home level 2, which is essentially where we were before the dial was instituted. So this is where we've been for months now. And generally, most people in the community have been able to maintain that level. We've seen really good compliance at that level. And this is, one of my colleagues put this slide together. This is our current situation. Our two-week cumulative incidence, so our case counts per 100,000 is at 405. Our 2-week average positivity is actually below 5%, which is great. And our 9-day hospitalizations. This says declining. It's somewhere in there, but it's a pretty good indicator at this point. We're in a pretty good place. So the big concern is if you have one of these indicators that's out of whack, that shows you going down the dial, that's when the state steps in and we have a conversation with the state. And now I'm going to go over that process because we're in this situation where I think as a community, we'd love to move up the dial, but our numbers indicate that we need to be a bit more cautious and figure out what our next steps are. And to that end, with numbers that indicate we should move down the dial towards safer at home level 1 or even stay at home, we have reached out to the state. We're in constant contact with them. We were in constant contact with them before, but now we're really focused on what's happening with the outbreak and how we address that. And that communication is really around, okay, if we have to move down the dial, we will, but are there ways we can mitigate that before that happens? And the way that the documentation is written now, the first point where we can really sit down with the state and talk about our situation is the 28th. So that's next week. And that would be when we would start talking to them about how we address this. And the next couple slides have a lot of words on them. I will just talk to them. I'm not going to read them, but I'm going to talk about a little about the process as we get to the point, because on the 28th, we are not going to be in compliance with all three of those metrics, the cases per 100,000, % positivity, and hospitalizations. We're going to be out of whack, definitely on the cases per 100,000. So this is what the policy says. Lots of words there, but the reality is that the state recognizes we have a unique situation. We have a large university that is geographically distinct, and when we are talking to the state, we are addressing that. We're addressing the fact that our case counts are largely a result of a situation at CU. And so while we want to help CU, while we want to see that outbreak through, we need to be aware of the fact that the rest of the community is in a slightly different position, and we want to respect that. So that's where our discussion starts with the state. In terms of that consultation, there are a number of things that the state can offer. They can, if we can address the CU outbreak through mitigation efforts that appeal to the state, that the state feels, okay, yes, this is a way to protect the CU students and protect the community while allowing the community to continue to operate at safer at home level 2, they will do one of these things. They'll provide a 2-week period to see whether we can get our cases into order. They'll set an extension that is based on our plan, or they could say, look, we feel like this is, you're right on the edge of a community-wide situation, so we do need you to transition to a more restrictive level. But this all happens in a conversation at the level of our public health officials and experts at both the state and the county level. So I just want to keep reiterating the fact that this is a conversation that's going to happen, and it's going to be an attempt to recognize that the county is working on strategies to address this. So again, lots of words on the slide. I apologize, but the general idea that the state is getting at is we are relying on each community to understand the community's unique situation, and where the state is going to respect our mitigation plans and understand that what we're trying to do is address a local situation. That's all to say that we are working on it. The state is aware that we're working on it, but really it won't be till next week that we really know what they're looking for and what they're asking for us to give them. That's a lot of information. And I don't know if Lane, you want to jump in with anything else there, but really that's our presentation at this point. So happy to take questions. I do want to mention again, this is our general update session. We do not have a special session this week. Our Spanish language sessions are released either Wednesday evening or Thursday morning, and they are in collaboration with the Latino Chamber. And I did want to mention, Corinne pointed this out to me. We need, there's a new link on this, and she's going to be providing a new link to these sessions in the future. So please note that there is a new link to sessions starting next week, I believe. I believe that's correct. And with that, I'll just say, please contact us with questions. And if you have complaints, if you have concerns, you can use our call center as well. So thanks so much.
Yeah.
Lane, did you want to add anything?
Yeah,
I think Jesse covered it really well. Unfortunately, there's just a ton of ambiguity still at this point. So we expect that we'll be having dialogue with the state. Certainly, if we can contain the current outbreak to CU, I think in those scenarios Jesse presented, very likely we will continue with mitigation strategies for CU, and then we will we'll hopefully keep the rest of the county as more status quo in level 2 safer at home as we are. If we see community-wide spread, that probably will change things dramatically. So I think it really is dependent on where are we at next week and how much things have changed. But in no case will we not see numbers that are going to put us, out of safer level 2. I mean, we already know based on where we're at now, there's sort of no scenario, even with like 0 cases a day, that will drop below that for a 2-week average. So right now that outbreak is definitely going to trigger that discussion for sure.
Okay. So Jesse, could you give a little bit of an update about the 2 new Boulder County testing sites that have popped up, and if there's any thought of those if those are going to be extended past the current dates?
I do not. Well, okay. First, let me talk about the 2 sites, and I know of one location, the Stasio Ball Fields. It's a free testing drive-up site, and actually, I don't know the address of the walk-up site. I don't know if either Corinne or Lane, you have those. We can get that for you in a moment. But in terms of availability, they are open 9 to 3, and anyone can go to either one, and they are free. And I have not heard if they're going to be extended, but I also haven't heard that they're going to be closed.
So the walk-up testing site is Pleasant Street parking lot. It's 1205 Pleasant Street, 1 block west of Broadway in Boulder, and I'll provide a map link in the chat.
And I sent it out last week in the
Thanks,
email. So I sent out both testing sites. So one's the walk-up, one's the drive-up. There have been quite a few people tested each day, and the results have come in within 24 hours in most cases. So
I can tell you from personal experience, it's very easy. I went yesterday, it was great. So
apparently the testing procedure has changed a little bit where they're not digging all the way into your brain.
Yes, that's
Okay.
maybe the best part.
So I've gotten a lot of emails since I sent out the dial framework to businesses that feel a little out of control, that feel like, what can I do to help have any control over this situation? And so I think the question is, what can each person do to help control or help in a positive manner, our current situation?
I mean, so not to put Lane on the spot or anything, but I really appreciated he just recently said we have to take care of each of us is responsible for ourselves, and each of us needs to follow all the public health general guidelines: wear a mask, wash your hands, socially distance. Try to, this goes all the way back to a couple months ago. People got really sick of the slide that I put up about risks, and commenting about activities that were riskier than others. Think about the activities you're participating in and the kinds of activities and the safety of activities that your business provides as well, and really be honest with your customers about how careful they need to be if they're participating in activities, because each of us can reduce our risk based on our behavior. But we as individuals, we as a community we have not been able to go to CU and talk to each kid and say, please stop having parties. Beyond that, really, each of our behaviors really we just need to think about our own activities. That's going to be the best way for us as a community to stay in level 2 and maybe go even to level 1 in the future, recognizing that the county and CU are working with the students and with the whole community on the Hill to try to address that situation there. And I don't know if Lane or Corinne, you have any additional thoughts on that.
Well, and I was going to say, and somebody actually wrote this in the question, that, I am so proud of the businesses in Boulder County for the amount of engagement they've had with Boulder County Public Health, with their chambers, with the economic development, with their industry associations, to assure they're following the rules and to follow the safest protocols they can. And if we continue to, in your space, follow those safe protocols, ensure that you're doing the social distancing, you're doing the checks, you're wearing masks, and assuring that we in our own space are not, creating outbreak in our own area, and we're helping to just keep that outbreak where it is, then maybe we are controlling the situation. We are creating control where we can, and that we continue to do that. And I think that's the positive. When I talk to the thrift store and I talk to the hairdresser or anybody that calls me and I say thank you for doing this, for continuing to do this, and other people are, I think that's the control you can have. And that's where Lane and Jeff Zayak and all of them, when they're talking to CDPHE and they're making the case for our business community and for our community to be able to stay in level 2, those are the cases they can make, because if we can keep it at CU, we can say we need to stay at level 2 because of this. And I think that's what I wanted to say, because I just want to say thank you to all of you on these calls, because we've had thousands of you engage, and that means that you want to do it and you want to follow the safest protocols.
And I would echo that completely. I would also just say, my team and I talk to businesses every day, and businesses that have sick employees, businesses that are trying to figure out how to engage. They've been super responsive, and it's actually really nice to talk to a business and say, yes, this is a scary thing, this is a problem, we can work this out. And by and large, everyone has been supportive, and I echo what Corinne said. I totally appreciate the situation you're all in and the really positive way you've been approaching this.
Okay. Anything? I know, Lane, you already you said some areas. We had a question come in about how will businesses, organizations be informed if, after your conversations with the state or at any point, we do end up moving to level 3 or worse, the other area?
Yeah, so that will definitely not happen. We won't be moving Monday or Tuesday next week. We'll be in that dialogue phase with the state. We'll be looking at our data to see are things kind of stable, at least from where they have been, where it feels like while we've seen all this rise in cases, it's still very isolated demographically to age groups and localities within our community. If it's not, we'll be likely proposing additional actions that we might think could further contain it. But again, we have to really look at our data next week and see where we're at. And we will obviously, we're not waiting for the state to do any of this. We've been doing this for the last several weeks. In fact, there's a lot of plans we've already put in place, more plans that we've got to put in place. So we're not waiting till next week to take action. We've been taking action since we've been monitoring this. So it's just a matter of when will we hopefully see some of that pan out. But again, we will have that ongoing dialogue with our business community too. It won't be a surprise to you when we potentially make any changes. But again, our goal and what I really hope to happen is that we are able to contain this and just focus strategies on the outbreak, and the rest of the county will stay in its current level so that we won't have to have any further changes for those businesses.
And one of the tactics we've been talking about is using the current framework, which is these webinars. So the other chambers, economic development agencies, municipalities are being asked to filter businesses through this platform. So even if you don't attend a webinar, to register for one, so that you're sent updates via this platform as much as possible. We've had thousands of businesses engaged through this so that we get it out through the different channels. I also send most of the updates out through the chambers and the EDCs and the municipalities so they can send it out as well. So we're trying to filter the information through singular sources. So that's how we're working on it. We're going to continue to have these sessions. I was telling Lane and Jesse, I don't think we're going to be ending these sessions anytime soon. For a while. I just extended it on their calendar for the indefinite future, because I think there are going to be questions, and there are going to be periods where we're going to just need to make sure we keep the business community informed. We're going to have questions. We're going to need to make sure we continue to communicate. So, plan that we're going to continue to use the current channels that we have. And if there's industry specific issues, so one of the questions are, what's the big difference between level 2 and level 3? Yeah. And some of those are, and you can, Lane, if you want to, Lane and Jesse, if you can address that. There are some industry specific, we might have to address those within those industries.
Yeah, so what I did is shared the link to that state dial framework. So you can look at your specific guidelines and restrictions for the different levels. So depending on what sector you're in, the changes might be significant or might not be significant. Largely, it's around the number of people that are allowed for your kind of specific sector, and then what other eligibilities there might be. So again, if you look at that link that I posted in the chat, that should help get you to, you can look at your sector and see what potentially that would mean. Obviously, if we went all the way to stay at home and severe, that's a dramatic change for everybody. And in some cases, that means you're closed or we're not able to do it. So that's what we absolutely want to avoid. But the only other exception, this isn't really intended for our school district folks, but they have some additional criteria beyond just what you'll see for, like, it's very abbreviated. It's not all encompassing for the schools of what's on that chart. There's a whole sort of another piece for schools.
So we have a question about, speaking of schools, any concerns with St. Vrain Valley School District and now BVSD going to a hybrid model or in person with cases, with the influx in cases? And I know that Boulder County Public Health presented at both school district meetings in the last 2 nights, and I listened to both of them, and I think they did an amazing job presenting why, with this influx, would you recommend, moving to a hybrid or allowing in person. But if you could just give just a brief answer to this question, are there any concerns about St. Vrain or BVSD moving to a hybrid when you see these numbers?
We're never in a zero risk situation. So I think that's important for everyone to always know. So all of our messaging that we've been sharing for so long still applies. So it's really about screening people who are ill, really making sure that we have good hygiene, that we're wearing masks and we're social distancing. So all the schools have had intense amount of planning for how they could do in-person classes. And honestly, even within the CU outbreak, there's tons of guidance and effort there to manage those risks within the classrooms. And I'm pretty confident that's not where the exposures are happening. So again, certainly there's an introduced risk there, but is it one that can't be managed? I don't think so. I think we're in a place where, again, if we aren't seeing community-wide spread, it still makes sense to move forward with those plans, because there's been extensive planning to address these risks. In fact, there's plenty of private schools that have already been doing in-person classes already for months now or more.
My husband teaches at a school that's been in person for 4 days a week for 5 weeks now, and they haven't had any cases at his school. So. And
even I'm not saying that we won't see any illness, because we expect that there's, a certain amount of illness that's still unfortunately happening. It's been a matter of implementing all the plans to isolate and quarantine those exposures and not allow it to just continue to spread through the school and community.
So, and I do have a couple industry specific questions. And there was a comment that there was a case at a Montessori and some others, but as you mentioned, there will be cases, but they have plans in place, cohort, quarantining, things like that. There have been cases at schools. It's just there are plans in place in those situations. I have some industry specific questions, but I'm going to get through some of the dial and more of these bigger picture questions. Why not just send CU students home?
Lane, do you want to answer that? Or,
yeah, I mean, I guess it's not as easy as that. These are adults, so I don't know that we have a power. We haven't seen where anybody is actually removed from a location, like sending someone out of a county or anything like that. CU is looking, and I think is already implemented effective today, their remote plans, where that means a lot of classes are either online. It's very sort of critical, essential research types of people that are still going in person to labs and things like that. But again, as I mentioned, the classroom itself is not really the exposure. It's the other activities, I think, where we have, that 18 to 22-year-old demographic, where we've seen the huge spikes that Jesse showed. And again, so canceling school completely doesn't remove people from our county. And so again, the broad powers of public health, I don't think we've ever tested or have even thought about the idea of trying to send people out of our county and send them somewhere else. So we have people in our community, and so if they don't have class, that unfortunately would give them more time potentially. So I think we still need some of that structure. And then there is certainly penalties that CU can impose on their students. So canceling things completely, that at least is one avenue of influence and enforcement on students is that the university can take action on them as well.
Okay. Sorry, I'm pulling up a question that came in via email. We're going to go into an industry specific question. So are there any changes to the symptom screening that was recommended from the very beginning? Any new additions, any changes to the symptom screening?
Not as part of the dial framework. And I have not seen any other changes to the symptom screening, both the practices and the maintaining a log of that. But I don't know, Lane, have you seen anything?
Nothing that I'm aware of. I'm just going to click on that kind of business guidance just to see. I mean, I think there was, but this has been a long time ago, there was sort of a temperature change, but that's probably 3 or 5 months ago of some of the critical temperature that was monitored, but we haven't seen any changes in any of that.
And someone added on to this question, regarding screening people who are sick, should we be looking for any symptoms listed by the CDC? My organization is concerned about being so strict about symptoms that staff will be hesitant to be honest about some of the more general symptoms, especially heading into cold and flu season or allergies or so forth.
Again, I think with allergies, you have some symptoms. So it's pretty important to distinguish that someone already has underlying issues versus these are new symptoms. So again, I don't think there's been any change. It's really about looking at again, doing the temperature monitoring is one piece, and then fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, diarrhea. So that's your symptom screening. But again, if you have some underlying health issue that gives you some of those symptoms already, that should already be something that's part of that distinguishing piece. And again, these would be sort of new symptom onsets rather than, again, underlying conditions that people already have.
And even though it's cold and flu season, if someone is sick, they should stay home.
Stay home. Yes, I was about to say that. That's the message we should be giving, especially as we head into flu season. This is
my hope is that this is the best sort of flu season ever, because all the prevention things that we've been talking about this whole year address every respiratory disease for the most part. So if people are staying away from others when they're feeling ill, they're wearing their masks and washing their hands, we should prevent a whole lot of respiratory disease.
Speaking of flu, any guidance on, there was guidance that came out earlier that people should wait to get their flu shot. Is there any change in that guidance, or should people start getting their flu shots? I think there's questions coming in as when people should get their flu shots.
I know that they were saying kind of wait until like around now, like the beginning of October. So I think people need to certainly plan and go get their flu shots.
I know some of the local hospitals and clinics are doing drive-up flu clinics because people are afraid. But look at some of those drive-up flu clinics, flu shot options that your providers are offering.
I'm getting my shot next week, so I would encourage everyone to do the same.
We should make Lane get it on the call. That'd be great. I'm just kidding.
Yes.
On the scene, we'll do a live drama-filled call. So one question was, are we requiring businesses to do temperature monitoring for customers? And Jesse, if you want to clarify I think it depends on the industry, correct?
Yes, absolutely. And really check your industry guidance on the website. I don't have it in front of me and I don't want to go through each sector, but covid19.colorado.gov, you can look by sector and it'll say what you need to do, whether it's just employees or employees and customers. But as a rule of thumb, if you are in a lot of very close contact, you're probably going to want to be checking your customers' temperatures as well. That's for your safety and theirs.
So even if it's not required, I've seen some.
No. I don't want to encourage you to do more than you need. That's really up. Yeah, I guess I don't want to encourage you to do more. From looking at the guidelines in the past, what I noticed was in industries where you're really like limited healthcare or personal service, where you're interacting with someone one-on-one, not able to maintain that social distancing, that's when often they're asking that you do a customer check as well. But definitely check your industry specific guidance. I don't want to give people either a false sense of security or make them nervous about whether they're following the rules. Check your industry, and that's the best way to go.
So on the state, and I think every time I send out a link to the sector specific guidance on the state. So if your personal services or your limited healthcare, your office, check that specific area, and I'll talk about customers or external outside the employees. So I think there's a question is if somebody does show a symptom, it's not a question, it was a comment, but I think it's a question. If someone does show a symptom, do they need to stay home for 10 days due to a singular symptom, even if that symptom does resolve? Or is there a designated time they need to stay home if they do answer yes to one of those symptom screenings?
Yeah, that's a good question. I think it's dependent on what's going on, of whether they may need to expand and go get testing or not. But typically we're looking at people making sure those symptoms are resolved before they're returning. And then let me look for that link so I can make sure to provide it to you. So people know the exact piece.
Okay, and then this question is about events. So some guidance was sent out, and I saw this also on the event site. I mentioned it a couple weeks ago, but this was specifically sent out from the Hotel and Lodging Association and some others, that the state released, and I'm quoting the email from the associations, that the state released new guidance for indoor events to allow events where individuals are provided reserved seating and or individuals will remain seated for the duration of the event to be held with a capacity of a maximum of 100 people per room with 6 feet of distance. So that's not a networking event, that's a seated event. And I think it shows that, and that's as long as we stay in our current dial framework, level 2, and I think the question is that correct? Was that correct guidance given by the association? Is that something that events facilities can follow? And then I think the second part to that is if it becomes a seated and unseated portion, they need to go back to using the social distancing calculator and that 12 feet of distance around a person.
So I don't have the internet in front of me, so I can't check that quickly. So I don't want to give you one way or the other. I think we can get back to you on that unless Lane, you've been able to pull that up.
Yeah, I'll add the link to our indoor events.
Great, thanks.
So, and I'm pretty sure on the state indoor events, it's on the top. It now says it on the top, but I think the caveat there is as long as we stay at level 2, the moment we switch to a different level on the dial, all of those capacity limits in some of these items change.
Yeah.
Which leads to another question. Someone did look at the framework as Lane sent out and asked, will gyms and fitness centers not be allowed to hold in-person classes under level 3 concern? So if you look at that chart, it now changes what you can do as a gym and fitness center. It changes offices to 25%. The capacities change. So looking at that chart, that's what it reads, correct?
I'm hopping back and forth between.
Sorry, Lane, I know Jesse can't look.
Sorry. Yeah, I'm down to one screen, so I can't look at the presentation and.
But I've got all the links that I keep adding, so I can go back to the links that I've already provided you guys. So now, let me get to some of those quickly.
They're very engaged this week. I just have questions keep coming in.
No, it's good, and you should really pay attention, read what they say, and where it gives you allowances, you can. And so, just to answer, I guess the other question that had just been asked is yes, for indoor events, that is correct. All those things that were said, just have to still follow all those caveats about making sure people are seated and that 6 foot of separation is maintained and all that piece. So,
and so that 6 feet is from person to person. We've clarified this in a previous webinar. That's not table to table. You want to make sure there's 6 feet between the people, and between the people.
The way sorry, go ahead. Sorry, Corinne.
So that I just wanted to make sure that we've clarified that on a previous call. Now that you're following a restaurant, go ahead, Jesse.
So the gyms and fitness guidance for level 3 does say virtual or outdoor in groups less than 10. So that to me means that yes, gyms would be closed at that point.
So
yeah, it doesn't specifically say indoors is closed, but that's sort of what it suggests. But again, that's the abbreviated chart. So we will dig into all of that to see exactly what it says, but it will definitely impact what you're currently doing. There's no doubt about that.
So I think to clarify on that the state issued symptom screening form specifically says to exclude employees exhibiting any symptom from the workplace for 10 days. I think there just needs to be some clarification on whether if it's resolved, how long someone has to stay out. Because if that's one of the reasons that they're worried about people lying on the symptom screening is if they have to stay home for 10 days for saying I have a headache. I think there's some concern there. So if we could get clarification, maybe I can send it out after the webinar. We can do that. Okay, if employees have kids and their kids have one or more symptoms, do they or their kids need to be tested before coming to work?
Sorry, can you repeat the question?
If employees have kids and their kids have one or more of the symptoms, do they or their kids need to be tested before coming to work?
So all of this is focused on the employee. Just because they've been around people, that puts them at risk. So it's certainly important to find out, are you potentially exposed by somebody else that was ill? So, but just because they have been around somebody else who was ill doesn't mean they have to go have all those other people tested in order for that employee to come to work. So everything is focused on the employee specifically. But again, knowing that if they know they've been around somebody with COVID, that changes things. If they're a high risk, they may need to quarantine because of that. But it is important, especially if you have sick kids, find out what it is so that you know whether or not it is COVID. But there's already respiratory diseases out there. I know several people who are ill and they don't have COVID. So, and Corinne is one of those people that was ill a few weeks ago and was not COVID either.
Yeah.
So just to go back to the recreation question, in level 3, I'm looking at the public health order, and under level 3, gyms, recreation centers, and indoor pools are not authorized to be open. So that's a big change.
Yeah. When you look at that document, I mean, offices moving to 25% capacity, restaurants moving down to 25% capacity. I think that, we want to stay at level 2. I think that's what I've heard. And I know that's, we all, like we said, we control what we can control and, try to keep that outbreak at the university. So I think we have a question about another public health concern, and that's mental health. And I'm not sure if we can, I think that there are mental health issues coming up. We've talked to businesses who are concerned about employees. I think that there's higher levels of drugs and alcohol consumption in our community. How can we as a collective community, maybe, what's public health? What are nonprofits? What are we doing to take action on some of these other public health crises moving forward as well?
Well, I know mental health is one of our strategic priorities to support that within our community. We know that has been, stressed even more with COVID. So continue a lot of the underlying public health efforts that have already been underway, but we know that COVID has stressed and strained some of those things. So certainly making sure people have access to support for mental health specifically, that includes, some of those comorbidities with substance use and things like that. So there is a lot of effort to support those issues that have been ongoing before COVID and are still ongoing now. But we do recognize that COVID has added a strain to a lot of issues.
Last week we had a session with places of worship, and I know they've also, stepped in and played a role in this as well and helped be a space for individuals to reach out, especially when you can't have large services, but that one-on-one consultation and someone to reach out to. I think as a community, mental health partners is still available. There's a lot of those community, they just all had to change how they provide their services. And I think just, all of us continuing to be part of the dialogue and helping individuals connect to those services in this new virtual world, and figuring out how to navigate will be all of our responsibilities. If you see somebody that needs help, connecting them in the right way, especially when, it's not that let's walk into a facility like we used to walk into a facility. All right, a travel question. I think we've had this question, but this question's about, we're having a staff person travel internationally. First time we're dealing with travel internationally. I think there's also questions about nationally too. Are there general state guidelines about self-quarantining upon return to Colorado, nationally or internationally?
So I'm going to look this up in the order, but in the past we have, the state recommended 14 days, I believe, afterwards. But let me take a look here.
And I've sent this link out before, but this is also an HR legal issue as well, that you also, and I'll send it out again, but this is something where it's a policy type situation. If you're going to do it for one employee, you need to do it for all employees. You need to let them know beforehand, so that it's an equality, it's a policy issue. And so I'll send the link out to a blog that was written by Employers Council, by a lawyer there, just about this particular travel issue. So if, there's guidance pieces, but there's also the HR component to it as well.
So I added the travel guidance, and it's specifically guidance. I don't think there's any prohibitions.
Mhm.
Certainly, I think it's still recommended that non-essential travel not be taken, that you don't participate in that. But there's no specific Colorado restrictions on putting people into quarantine. Now, I don't know if there's anything federal still at this time, depending on specific. So that link I gave you has additional sort of CDC traveler considerations, so there's some additional links that you may need to go for foreign travel. But it's still the same kind of precautionary pieces for people traveling. And again, when they come back, looking at exposure risks and symptom screening, all those pieces are still in place.
We've kept you busy today, Lane, with all these links.
Yeah.
Yes, thank you, Lee.
What type of business do theme parks or attractions, what type of businesses are theme parks or attractions considered?
They are looking up by sector here.
Because I think they're not allowed.
We're playing Stump Boulder County Public Health today.
Yeah, this is good stuff.
Yeah, they were, as I recall, they were called out to still not be allowed. So I don't.
I think in the order it's all businesses except blum blum blum. I think they're still called out.
So they don't fall into one of the sectors that is allowed. So that's the hard part. So so they're not one of the guidance sectors that allows them to operate.
All right, noticing that level 3 does come with some drastic changes for some of our businesses. When would be the earliest we would move to level 3 as a community if consultations don't work, or our conversations with the state don't work? Or how long maybe would we be given to mitigate our current numbers, do you think?
It's just all speculation, unfortunately. So if things are as they are right now, we would go into that negotiation next week in a very strong place, that we don't see community-wide spread throughout Boulder County. We're seeing very localized Boulder spread, and even within Boulder, significant focus within specific age demographics. So if that's where we're at next week, I think we're in a very strong position to advocate for continuing to mitigate within that sector, and the CU outbreak, and not have to move at all for the rest of the county. If we see community-wide spread everywhere in Boulder County next week, we might be moving much sooner, and we probably as public health would be advocating for that, hey, we have outbreaks everywhere right now. We need to unfortunately move everything back. So again, Jesse said this, everybody can control their own choices and personal behavior, and that's what we need everyone to do so that we do not see this spread throughout the community.
And one of the reasons we're seeing these high spikes is because you're doing massive amounts of testing at CU. You're trying to identify all the cases really early on so you can stop that spread early on, which is probably why you're seeing a large number of cases right now, and hopefully get this under control, correct?
Yeah, that's definitely a big piece of it. When you expand testing, you're going to expand how many people show up positive. The kind of key pieces are looking at our positivity rate, and I think Jesse may have showed that. If you didn't, that's on our website too. But our positivity rate has gone up. So it's not just that we did more testing and we got more people positive. We're seeing more people testing positive in addition to testing more people. So that is not a good trend. So that's a challenge. That being said, we're still at a positivity overall rate that is in that very low, good kind of place. So that kind of could even qualify us towards, that some of the protect our neighbor measures. So we're still in a good place, but it's because we were in such a great place. We were at, I think, 1% positivity, and now we're at 4, closing in on 5%. So that's not a good trend. And then, but again, a lot of it is doing very targeted, focused screenings. And so really increasing that testing dramatically has helped identify a lot more cases, and hopefully will contain it.
Great. All right. I have no more questions that have come in. We had, that was a lot of questions. It was all over. We did have a follow-up question to the amusement park, but I did let that individual know that we'll follow up offline, because I think we need to do a little bit more research on, even in the dial, even in the dial situation, we need to figure out where amusement parks and theme parks would fit. Yeah. So I think we have another question coming in. Hold on. I always say that. We have no more questions. Another one comes in. I think we had someone just say, another comment that, the important part of this is to help the spread. I know that this is an inconveniencing time for all of us, but we need to have compassion for employees, for employers, for each other, and that health. If we get the public health crisis under control, we'll get the economic crisis under control as well. Here's a good question. Should businesses do anything special in regards to CU students? For example, restrict their access, not allow them to come in as consumers or customers? And then I think there's a second part of the question: what if they're an employee of the business?
We're going to be taking certain actions and steps, but there's not anything in place that's restricting that at this point. I think it goes back to those employee screening and really thinking about what are the risks there. We do know that 18 to 22-year-old age demographic is where we've seen, I think, 80+% of our cases. So that's a very concerning age demographic. But as far as right now, orders to not allow people, that is not that's not our directive. But I think it's really, really imperative to really get a good vetting of the risks of your employees. But we aren't trying to demonize students and people that are in those age demographics. Just because you are 18 to 22 doesn't mean you've been going out and violating public health orders. So I think that's an important message back, I think, to what the other person's comment is, we still are a community, and CU is part of our community. And so we have to work through this as a community.
So, if you're a retailer or a restaurant, follow your protocols, wear masks, social distancing, symptom check if that's part of your part, and make sure you follow the safety protocols with everybody. Including, we have another one that came in, so let me just check this.
CU has a voluntary sort of stay at home for their students. So students should be not going out except for sort of essential things to get food, go get medical care, things like that. So students should not be out and about. And so that's a piece of, it doesn't necessarily give powers to businesses to start trying to identify students and restrict them. But you certainly can call attention, where appropriate, that hey, you're not allowed to be doing certain things. That doesn't restrict them from going to their jobs, though.
Mhm. This was another question. Is there anything you would recommend we do as Boulder residents to encourage students we may see at local businesses to follow health and safety guidelines? How do we as a community help them understand the impact of our larger community? I know that there were talks of doing some restorative justice videos, more videos with businesses, talking about the impact of the health crisis on businesses, and having those available to students who do violate public health orders. I don't know what your answer to this. I don't know if going up to a student and saying, you're not following, I don't know if that's the right answer, but if is there anything else you would suggest that, Boulder residents could do to help, or the community could help students understand the impacts on the community as a whole?
It's really challenging because we aren't trying to encourage confrontations amongst people. And so having a difficult conversation is not in everyone's wheelhouse and skill set. So, it is important that people know that your actions have a bigger impact than just yourself. So that's just a message that we're trying to make sure is out there. We aren't trying to ask our community to now police the rest of the community. That probably will backfire dramatically if people are trying to do that. But it is, again, you can control your own actions. So model the behavior we want, and the more that becomes a norm, and then people who aren't doing it are not the norm. So I think, again, you can model the behavior, and that's what we want people to do.
So don't let people in without a mask. That's the law.
There's definitely,
anybody.
As a business owner, you already have those capacities to make sure people are social distancing, wearing masks, and doing the appropriate things. So,
and we as community members, we model that behavior when I'm out on a trail. I wear a mask. Modeling that behavior and showing that we're controlling ourselves. We're controlling the behavior we want others to follow. And showing compassion and empathy for everybody is a good role. We have one person say they're new to Colorado. Can you elaborate who is required to wear a mask? As a last question, and then we'll close out since we're on at time.
In Boulder County and throughout the state, you are required to wear a mask if you are in a indoor public space, and that's pretty much anything that's not your house. In terms of Boulder County specifically, if you are outside and are in a situation where you don't think you can, or you cannot maintain 6 feet of social distancing, you need to be wearing a mask. There are municipality-specific regulations at the state level. Children under the age of 10, 11 do not need to be wearing a mask, although it is encouraged down to age 3. And I know that some municipalities have actually made that their minimum, saying that children in public indoor spaces to the age of 3 need to be wearing masks. So make yourself aware of what your municipality says, but generally, if you're indoors in a space that is not your house, you need to be wearing a mask. And if you're outdoors and can't maintain 6 feet of social distancing.
So, yep. And some of the like you said, some of the municipalities have their own orders. So, as a reminder, I'll send out the links to those again this week. So,
thanks, Corinne.
So, I hope everybody has a wonderful rest of your week. We will see you next week, and let's continue to be compassionate towards each other. Continue to follow the rules and stay safe. Let's get our public health crisis under control so we can get our economic crisis under control. Let's get your questions answered. Ask them in between the webinars. Continue to stay engaged with us. As you can see, things continue to change, and we will continue to communicate in the best way we can and answer questions as best we can. And we will see you next week. Thank you.
Thanks, Corinne. Thanks, Lane. Thank you, everybody.